Hey everyone, today with us we have Dr. Sucharita Nanjappa ma'am, who is a senior lecturer at the School of Dentistry at University of Dundee. Welcome to our program, Medula ma'am.
Thank you.
My first question to you is, what made you choose the field of dental public health?
Because I was not very comfortable with the idea of the business side of dentistry. For me, I joined dentistry to make a difference and do something, meaningful and impactful. And for me, I was not very comfortable. I know that is part of dentistry, but for me, it was not. Didn't sit very well with me. So, dental public health for me offered me something different, and I felt I could make a difference through that rather than the regular clinical side. Yeah.
Ma'am, could you tell our audience a little bit about your journey from India to UK as a dentist?
Yeah, so I think it was 2005. Again, my dates might get mixed up. But the dental council they conducted some exams in India because they were looking to recruit more dentists into the workforce. So they conducted the IQE, it was called then, the registration exams in Chennai. And a friend was doing it, so she just said, come along, do it. So we did, and then we went to London to be observers on clinics there. And I realized, there's still the business side to it, the stuff that I was not very comfortable with. So I met someone doing dental public health and decided to go in that direction instead. So applied for my master's, and I really enjoyed it and decided to do a PhD. So in Queen Mary in London, and it's just an opportunity presented itself. There was a post opened in Dundee for the same work that I did for my PhD. So I started off as a postdoc research fellow, and then they started a new master's in dental public health I assisted with, and then I changed over to becoming a lecturer. And so, helped to set up the course. And
So it all worked out for you in the end?
Yeah, nothing planned at all. Just worked out that way, yeah.
What inspired you to start this MDPH course?
I think it was conversations with Kanta. He was keen to have something that would work for both of us. And when he was talking about what you all do here at GSL, and then, all the courses, extra courses that were done during internship, and we thought, how can we do something together? And again, conversations with him and Peter and other colleagues and things that came out by the WHO and the FDI, saying that dentists need to be retrained because there's so much inequality in dental health around the world. And what can we do about it? And this seemed like the obvious option, because lots of people want to go back and do clinical work because that's why they joined the course in the first place. But that gives them broader skills and the ability to make an actual impact and change the lives of a lot more people than they would otherwise. So we thought to us, it's an obvious fit, but it needs time to work for more people to see it work.
I think this is a great opportunity for all the students because not only they get their master's degree within 6 months, but they also get to improve their skills. So it is definitely a win-win.
Win-win, exactly.
I'm coming to my next question. Could you brief us a little bit about the Chatterbox service that you started?
Okay, so that was something I developed when I was a research fellow. And in Scotland, even though healthcare is free, and a lot of the encouragements, we have a national program in Scotland called Child Smile, where one part of it is it was set up to reduce oral health inequalities, and it starts for doing something from childhood. So there's an intervention. They were trying to get more people. So a lot of people register with the dentist, and we wanted children to be registered from birth. But we found that a lot of families would register but not attend. And they have support workers called dental health support workers who can help these people who are finding it difficult to attend the dentist, help them to make it to dental services. And Chatterbox was a communication interface, kind of a tool that we developed with the school, Duncan and Jordanston, our design school in Dundee. So the Masters of Design students and us came up with something that helps these dental health support workers interact with these families who have a lot of difficulties and find out what their main challenges are and why they're unable to attend the dentist, and use that, to problem solve and find out what the real issue is so they can begin to address it.
You have done a lot of research and you haven't confined yourself to topics like medicine and dentistry, and you have explored fields like communication skills, self-efficacy. So what made you develop interest in those fields?
Actually, I think the person I worked with, so the late Professor Freeman, so I joined as a research fellow with her and then started the master's with her, and she does a lot. I think one of the first few people she's written a book in communication in dentistry, so she was in that field and she has a background in psychology. And for me, all of them fit so perfectly into what we're trying to do. Dentistry doesn't sit in isolation. It's all these other fields that support it. And more, we realize that the best way to make a difference and improve, if you're talking about oral health, is to work in collaboration with different people in different departments. We can't sit alone in our isolated world and hope to make any changes. And for me, all of them fit so perfectly together, form this nice bigger picture. And yeah, I find all of them equally interesting. There's so much, and yeah, so much we can learn from these fields to make a difference.
Nowadays, having good communication skills have become an essential part of life.
As important as your clinical skills.
Coming to my last question, for students who want to go to UK, when is the right time to start the process?
As early as possible. It's never too early, let's say, because there's a lot of work, and first to research where you want to go and exactly what you want to do. Get in touch with the people running the program, find out more. Don't assume you know what's going to be delivered or what the program is about based on the name, because a lot of people do that. So as early as possible would be don't make any hasty decisions and leave it to the last minute. Plus, visa and paperwork take a lot of time. So I would say if you can do it, start a year before, go ahead and do that and be well prepared.
Thank you so much, ma'am, for coming today and giving us your valuable interview. It's a huge pleasure for us.
Thank you so much. It's a pleasure for me too. Thank you very much.